Hello everyone, my name is Anthony Marzuka, and the chapter I chose to review for this project is Chapter 12, which focuses on the direct patient care and the team of the hospital. The reason why I chose this chapter is because as somebody who works in a hospital, I feel that it's important to really understand what each department does in every hospital and what part every person plays individually in the hospital that creates the success that each hospital offers their community. So before I go over the different positions in the hospital system, I want to overview about Chapter 12. So in any healthcare system, the medical staff is known as an organized body of medical doctors, registered nurses, and patient representatives, in addition to many more other personnel that work in the hospital. The success of a patient flow is based upon how each of these individual teams work together. And every single individual department plays a critical impact on the quality of care that the hospital offers. It's important that everybody that works in the front lines plays their own part in providing the great services to their community and the patients to keep that great standing of the name of the hospital within the community. So before I dive into them, I want to go over each department that are mainly known within the hospital system. So there are many different departments in the hospital, and each of them play their own role in success. So many of the departments that we know are pharmacy, nursing, physicians and nurse practitioners, laboratory, radiology, physical and respiratory therapy, and case management. Starting off with pharmacy, many times pharmacy departments in the hospitals are known to work behind the scenes in a hospital. So as a patient, you never really see the pharmacies. What a lot of the times when nurses are obtaining medications for their patients, pharmacies use what's known as kind of a tubular station throughout the hospital where they deliver the medications through a tube system that connects all throughout the hospitals through all the different units. So, in a pharmacy, their job is to ensure that the medications that are ordered from doctors are properly packaged and constituted in accordance with the prescriptions that the doctors or nurse practitioners put in. Pharmacists and pharmacy technicians both work together to provide these medications and other pharmaceutical equipment throughout the facility. Moving on to the nursing department. The nursing department makes approximately 75% of the hospital staff. Their job duties entail treating patients in all aspects and forms. For example, they must administer medications and obtain diagnostic readings on a regular basis based on each patient's individual treatment plan prescribed by their doctor. With that being said, medical doctors and nurse practitioners are those who are the forefront of the hospitals. They are those individuals who place orders and create the treatment plans for each individual patient. These healthcare staff members are known to have the highest rate of suicide in the medical field due to the stress and the impulse of patients that some hospital systems can have on them. Other support staff known in the hospital systems are departments such as laboratory, pathology, physical, and respiratory therapy. All these departments play their each key role in the success of the hospital. For example, laboratory, they are the ones who run the blood tests such as CBCs, chemistries, and metabolic panels. Pathologies is that department that runs the test of biopsies and can determine whether a tumor, for example, could be benign or malignant. Physical and respiratory therapy are known to be two similar departments with different purposes. And what I mean by this is physical therapy will tend to focus on more orthopedic patients, where they offer rehabilitation services for patients who are having orthopedic surgeries, like knee repairs or joint repairs. And respiratory therapies focus on the patients who suffer with respiratory illnesses such as asthma, COVID, or the flu. So now that we've gone over the different departments that are well known in the hospital system, I want to take a moment to talk about staff shortages in hospitals. Many times, staff shortages can affect the quality of healthcare that hospitals can provide for their patients. And a research study was performed in the United Kingdom back in 2015 regarding how the staff shortage affects patient care in a facility. The research showed that patient satisfaction was actually lowered when there were more than one staff member during patient interactions in the room. Due to these unfortunate events, it's leading to a path where many staff members are actually resigning from their positions, leading to these staff shortages. Experts say that due to the aging population and workforce, many workers are leaving due to the burnout. Many health systems are actually built around the requirement of labor, and the shortage can affect them tremendously. Now that we talked about staff shortages in a hospital, I want to take a minute to speak about scheduling and organization and how they can avoid these staff shortages. Each unit in a hospital must have a set number of staff, and the unit manager must work in accordance with them to schedule them based upon the desired hourly rates on a weekly basis. Each of these units has their own manager and supervisory leader that the staff must report to for any needs or concerns that they may have. Part of the organizational process involves collaboration and commitment from all of the team members across the units. So what this means is that the staff and the managers and leaders have to work together in order to create a successful unit and to be able to make up for the lost time that these staff shortages can lead to. In conclusion, hospitals are made up of many different areas and different departments, and they all must work together in order to continue the success of the hospital. Thank you all so much for listening and for viewing my presentation. I hope everybody has a great evening, and I look forward to reviewing everybody's presentation as well. Thank you.